Good morning, everyone. My name is Dr. Nazaneen Homaifar, and we are so excited to have you today to join us for our first webinar on orientation to UCSF prenatal care. I'm going to give another minute for people to join before we get started. Okay, let's go ahead and get started. And for those of you who just joined, my name is Dr. Nazaneen Homaifar. I'm an assistant professor of obstetrics and gynecology at UCSF and one of the providers who provides prenatal care. We usually the topic of orientation to prenatal care at UCSF comes up in the first visit after you have a positive pregnancy test. And we realized in a discussion with some of our focus groups that our patients were having a difficult time getting a lay of the land. And I don't blame you. There are a lot of parts at UCSF and a lot of different locations. And I think we have over 30 providers. And so, and they provide care in different offices and sometimes in multiple offices. So we are hoping to use this opportunity today to give you a little overview of what to expect in different facets of your prenatal care. And hopefully this orientation will be a reference point so that going through your pregnancy journey, you'll feel more comfortable and understand all the moving pieces. This is our first orientation, so we will definitely be asking for your feedback to see how we can improve this. We are still trying to decide if this is something we're going to offer on a more regular basis, or if we'll use a recording like this for our patients to refer to in the future. While we wait for everyone to join, can you please help us get a sense of who's tuning in today by filling out the poll that Bertina will be sharing with us? So I'm gonna see if this, from my perspective, it's saying host and panelists. Oh, right, can't vote, obviously. I'll give everyone a minute to let us know where you are, if you've started your care, where you're getting your care, if you've accessed any of our resources. And Bertina, if it looks like we've had good participation, we can go ahead and publish the results. I'd also, while we're waiting for the poll results to come up, like to introduce my co-panelist today, Kate Frometa. Kate is one of our fabulous certified nurse midwives who's been with us for 7 years. She sees patients primarily at the Mission Bay campus and works on our labor and delivery unit, or our birth center, twice a week. So there's a good chance that you might run into her or see her when you come into the hospital for delivery.
Hey, everybody.
And Bertina, do we have the results published yet, or can we see them? Okay, we'll give it a few more. Seconds. Before we get started, I wanted to share with you, we each as providers, we each have our own way of how we orient our patients to prenatal care. And the way I do it is usually by getting the guidebook that we give our patients at the beginning of their pregnancy. Either it's a hard copy, and pretty soon we'll be moving to a PDF form, providing that as a way for us to kind of go through your care. So I'll have Bertina share that with you while we get started. Oh, great. Let's see what the poll results show. So most of you are well into your second trimester, 65% of you. One of you is thinking about getting pregnant, and 30% of you are in that first trimester. So hopefully this will be very useful. The majority of you are getting your care at Mission Bay. And if there are any specific questions about care at Mission Bay, Kate will be able to answer those for you. I see all my prenatal patients at Mount Zion, so about 15% of you are from Mount Zion. And thankfully, the majority of you have not had difficulty navigating your prenatal care at UCSF. We're very happy to see that, but there's still a good number of you who have, so hopefully this orientation will be useful. And it sounds like some of the resources we have are underutilized. So hopefully this webinar will help you see how to use these UCSF resources we have a little bit more effectively, because it's wonderful that word of mouth is how most of you, what most of you have found most helpful, but we do want you to, we want to make sure that you know of the resources that we have, and definitely want to know how we can improve them. So without further ado, I just wanted to give you a sense. We have, many of you submitted questions ahead of time, and we definitely took all of those into account to come up with our outline today. Our outline is really going to focus on your prenatal care at UCSF. I know there are many questions about the COVID-19 vaccine and if it's safe for pregnant people. I promise you we'll be answering that in our Q&A, but the majority of this conversation is going to be about what you can expect with your prenatal care at UCSF. I'd like to start with answering the question of who will I see and what will my care look like at UCSF. So at UCSF, we're very lucky to have a wide range of prenatal healthcare providers that you can see throughout your pregnancy. We have certified nurse midwives like Kate. We have nurse practitioners, MDs like myself, and high-risk obstetricians, or what we call maternal fetal medicine specialists. They also go by the name of perinatologist. I just want to acknowledge, I think sometimes it's really confusing because we have multiple words for the same person or function. So I'm going to refer to them as MFMs, but those are high-risk obstetricians who do most of their work with ultrasound, but we'll also see some of our patients who are more high risk. It really, there isn't really much guidance about who you need to choose. I think it's dependent on a variety of factors, what you're looking for in your pregnancy experience. Potentially what medical conditions you have coming into the pregnancy or what you develop in the pregnancy. So I generally think of our midwives and NPs as one. I think UCSF is unique in that our midwives and NPs see medically complex patients that in some other places they wouldn't be seeing. But I think if you are someone who has multiple medical conditions or had a very difficult journey to the pregnancy, and let's say you have multiples or you have twins, or there are known conditions that we're going to need to follow in the pregnancy, you may choose to see an MD. There are certain scenarios where you might need to be seen by an MFM. I say that with a caveat that I often look at my schedule compared to those of my midwives and NPs I work with, and they are also seeing patients with multiple medical conditions. But I think that is a conversation you can have at your first appointment with the provider you see to see if there's any reason why you need to see one provider over another, provider type over another. We really want to strive for continuity. So we know that at UCSF, while we like to have you seen by one or two providers throughout the pregnancy for consistency, that we do not guarantee that that provider is going to deliver you. And I'll get into this when we talk about where we're located and where we deliver. It's just not logistically possible. So you might follow with a provider throughout the pregnancy, and then there's always going to be a team that's on call for the deliveries. And and they will be the ones managing your labor. The way I like to frame it for patients, and Kate, feel free to add what you think about this, is we all work here for a reason. We all really value prioritizing the health of the birthing person and also the baby. One thing that we are very proud of is our ability to help our patients have a vaginal delivery, and how we help support our patients with different types of providers to help normalize their experience. So I think the way I kind of leave it with my patients is that trust that the providers who are going to be on call have the same mindset as the person who is seeing you in the pregnancy, and will help you, will work with you to achieve your goals for the delivery. Kate, would you add anything to that?
No, I think that's a good way to talk about it. Another kind of common scenario that I encounter is that someone may have some medical conditions and still want to see a midwife. And so in that case, we kind of almost like a tag team, like you can see a high risk doctor for a few visits and then see us for some of your other visits. So that's a really kind of common way to go about your care as well.
And I think one clarifying question that you can ask at any of your visits is, do I need to see a specific type of provider? Or if you're sending me to get a consult, does that mean I'm going to stick with that provider, or do you mean that I can continue seeing you? In terms of who will I see, I also want to briefly mention specialty clinics. We have specialty clinics at UCSF, and there are many of those clinics, but one specifically is for those who have significant heart condition going into the pregnancy, or a history of high blood pressure. We have another clinic called the DAP clinic for people who have any significant conditions that involve the thyroid or diabetes in pregnancy. So these are clinics that you're going to be referred to. So your provider will refer you to those clinics. And again, you'll decide, it'll be a decision amongst the providers and you, once you're seen in that clinic, whether or not you need to go to that clinic on a consulting basis, so maybe a few times in the pregnancy, or if you will stay in that clinic to get the rest of your prenatal care. So I know there was a question about that, and we will help you offline figure out how you can see that specialist for diabetes. Moving on to what will my care be like? And I want to let you all know that in the recording, we'll have a timestamp of the different topics we've covered. Your care is going to look like in the age of in the age of COVID, your care is going to usually be a combination of in-person visits and telehealth visits. And I have said this before in webinars that I've helped host, but I really do think that despite a lot of the crumminess that the year has brought with COVID and all the restrictions and how our lives have fundamentally changed, there has been a silver lining in that we've had to rethink what is truly important and what is patient-centered for prenatal care. And I view the opportunity to do telehealth visits as one that is actually hopefully improves patient satisfaction. And so to that end, we have created a guide, and Bertina will share that with you if you can all keep that and open it up on a tab on your phone or on your computer, but a guide on how to think through your prenatal care during this time. Because even when if we achieve maximum vaccination and we see rates go down, I do think telehealth is here to stay. And this guide helps you understand what visits are really important to be in person versus telehealth or video. I want to say our suggestions for telehealth are just those. They're suggestions. If you feel like you feel more comfortable coming to in-person visits to have that face-to-face with your provider, please let us know. We don't want you to feel constrained by this. We want this to be a guide as to what you can expect and how you can plan accordingly so that you can achieve continuity and schedule out some of those appointments. Um, I'm just going to look and see if there's any questions. Hopefully I've answered some of them here. But the visits are going to be a combination of that first visit. We call it the new pregnancy confirmation visit. And at that visit, you'll get a brief orientation to your care. So what we're doing today, we usually do in like 10 minutes. It's a 30 to 45-minute visit where we have to pack in a lot of stuff. We need to confirm that everything is okay with the pregnancy and that it has progressed as we would hope it would. We need to talk to you about what prenatal care looks like at UCSF, and then all the prenatal testing that's to come, which includes routine lab work and also genetic testing. And then hopefully answer questions that you, I mean, not hopefully, definitely answer questions that you might have. And sometimes the way I approach it is that I know that people coming to the visit have so many questions, but we'll decide if there are questions that we can leave to answer further along in the pregnancy when those things might be more relevant. In terms of how to think through telehealth versus in-person visits, we have been asking our patients to buy a automated blood pressure cuff. So that's going to be and ideally a cuff that goes around your arm, not around your wrist, so that if you are choosing to have telehealth visits, we can check in on usually one of the most important vitals in pregnancy, which is blood pressure. And there is a mechanism through our electronic medical records where you can submit your blood pressure on the day of your telehealth visit or ahead of time, so that we have a sense of what your vitals are doing when you're doing these telehealth visits. If you have any questions about obtaining these blood pressure cuffs, some insurance companies are now covering the cost of that, and we can give you a prescription for a blood pressure cuff. Alternatively, we do have some loaner blood pressure cuffs that you can inquire about at your clinic. In terms of what will your care be like, I wanted to also touch upon genetic testing, because as I mentioned in that new pregnancy confirmation visit, a lot of the discussion is going to be about genetic testing and if it's right for you and what type of testing you might want to have done. Many of you are getting a video series called the Emmy series pushed to you through MyChart. Emmy is a video series that we outsource, and it's really created to give like a high school level of information on various topics. And I love it as a general overview of really important topics in prenatal care, but I always refer my patients to our prenatal guidebook and information that we have at UCSF to give you a little bit more of a sense of how we discuss the topics at UCSF. And for that, we actually, part of what we'll orient you to are the webinar series that we've already done. We did do a webinar under Zooming Through Pregnancy to Parenthood on genetic screening at UCSF and how to think through that. So Bertina's going to share that with you in the chat as well. So you have that if you, I forget what percentage it was, but for the small percentage of you that are in your first trimester, if it's still something that you're thinking about, or if you want to share it with friends, you can. When we think about your prenatal care, I want to touch on ultrasounds and their role. So ultrasounds are imaging that we do in the pregnancy that can give us information on the pregnancy. Most of you will have an initial ultrasound at your pregnancy confirmation visit, and that is what we call like a bedside ultrasound. It's an informal ultrasound where we are taking a look either with a abdominally or through a vaginal approach to check to make sure that the pregnancy is viable or that we are seeing the landmarks that we need to see to confirm that the pregnancy is healthy. Formal ultrasounds are those done in our prenatal diagnostic center. And you will have a list of those different locations on our WHRC website and also in your guidebook. But formal ultrasounds are done by a technician who is trained, and they are always read by an MFM or one of those high-risk OB doctors that I mentioned to you. So formal ultrasounds most of you, if you choose genetic testing, might have 2 formal ultrasounds in the entirety of the pregnancy. And that would be at the time of the nuchal translucency, so between 11 and 13 weeks, and then at the time of the anatomy scan, or at the 18 to 20 week mark. Some of you may have a reason to get additional formal ultrasounds later on in the pregnancy to check on the baby's growth, or if there are other conditions that you have that we need to check on. So I just want to give you that point of clarification, because I think everyone across the United States does different things. And for us, the majority of people will have those 2. The majority of our patients choose to get genetic screening. So they will have the nuchal translucency and the anatomy scan. And then you can check in with your prenatal healthcare provider to see if there's any reason why you might need additional formal ultrasounds later on in the pregnancy. Everyone will also get an ultrasound at the 35 to 37 week mark. That's going to be a bedside ultrasound or an informal ultrasound to confirm the position of the baby, to see if baby's head up or head down, so that we can think about delivery. A little about our prenatal diagnostic center. There are the visitor policy restrictions that apply in the outpatient or clinic setting are the same for the prenatal diagnostic center. So at this time, we do not allow additional visitors to come with you to those appointments. We know that they're very exciting. However, because we are still trying to be safe and socially distance in the outpatient setting, we are allowing people to video in whoever they want for those formal ultrasounds. So you can join the UCSF Wi-Fi when you get to the hospital and phone in someone. We do not allow video recordings of the ultrasounds, but as I mentioned, you can have someone join via FaceTime or WhatsApp or whatever you use. And all the images are going to be accessible through a link on MyChart approximately 5 days after the appointment. Alternatively, if you are someone that wants a copy of the images for yourself, you can get a CD from the film library as well. And that's something you can always discuss when you go to the prenatal diagnostic center. Ultrasound appointments are generally somewhere between 45 minutes to 60 minutes. If you happen to have twins, then those appointments are going to be longer because we have to look at each of the babies. And as I mentioned before, all of the images are reviewed in real time by an MFM. So you might not always see a physician when you go in for the formal ultrasound, but it will have been reviewed. So sometimes you'll have a conversation with a tech, the ultrasonographer, and if there's anything additional, then the physician might come in and talk to you, or they might give you a call or set up a telehealth appointment to discuss further. We have satellite locations in Monterey, San Mateo, Marin, and Santa Rosa. So if you are living elsewhere and it would be more convenient for you to go to those locations, please let us know ahead of time and we'll be happy to try and schedule you in one of those locations. I talked about the specialty clinics a little bit. I also wanted to talk to you about the ancillary services. And I don't necessarily think that's the right word, I guess complementary services to prenatal care, because we have incredible lactation consultants, we have incredible social workers and a whole behavioral health team in place. We have genetic counselors. So all of these are individuals that you might meet throughout the pregnancy or in the postpartum period. And you can read a little bit more about their roles in the prenatal guidebook. There's a page that talks about the different people that you might interact with. I know at this point we've talked a lot about what your care will be like, and hopefully it's been, I'm just going to check the questions. If there's anything else, you can always let us know and we'll answer it later. But in terms of where your care will be, just like we have ancillary sites for ultrasound, we have multiple sites to get your prenatal care at UCSF. So we have our main location, or where we see most of our patients, are at the Mission Bay campus at 1825 4th Street. We also have a practice at Mount Zion, which is like in the Lower Pack Heights area. Some of our patients will be seen at Owens Street, which is nearby to Mission Bay. And then we have providers that we'll see patients out in the East Bay and in San Mateo as well. So while your clinic appointments might happen at different locations, everyone delivers in the same place. And that's going to be at the UCSF Birth Center on 4th Street. So it's right, if you look at the hospital, the clinics are all on the left-hand side, and the inpatient setting, or where the hospital is going to be on the right-hand side. And so if you have any concerns, if you think you're in labor, if you think there's something wrong, or let's say you're in the first and second trimester and you have something acute like vaginal bleeding, you're worried about fetal movement, or there's something that you need a more urgent reply, we want you to go to our labor and delivery triage, which we also call an obstetrics emergency room. So think of it as an emergency room just for birthing people, where you go and you would be evaluated by a prenatal healthcare provider, and you might have some lab work done, some imaging done, and if needed, we'll keep you in the hospital if we're concerned about anything. In terms of the visitor policy, I should mention that at our current visitor policy, everything is going to be listed on our Women's Health Resource Center website under COVID-19, but in the outpatient setting, even if your partner has been vaccinated, we are only currently, and I anticipate it changing in the next few months, potentially, we're only allowing for you to come into the outpatient clinic setting unless there are extenuating circumstances. And if that's the case, you can call us ahead of time and we can and speak to the clinic manager to see if it's appropriate for you to have an additional person with you. Okay, Kate, I did a lot of talking and really finished up on where care will be. Let's have you talk a little bit about how someone decides whether they want individual care versus centering care.
Sure. So when you come for your first visit, one of the questions that, or one of the options that we'll go over is whether or not people want to participate in what we call centering pregnancy. So I'll just give a really quick overview of what that is. So we use a model of group prenatal care called centering pregnancy. And of course, pre-COVID, we actually all sat in the same room in a circle. And what that means is that you come to your prenatal visits with other people. Usually, right, it's about 8 families with the same month of due date that you have. And so it's just a really great way of, it's a longer visit, and you also get to hear other people's questions. Also, other people often have answers and knowledge that maybe your individual provider didn't have. It's, you know, it's things like, oh, I've got back pain. Like, oh my gosh, me too. I got this pillow for it. I'm doing that for it. And so you really get to build this community among other people who are kind of going through the same thing that you are going through at the same time that you're going through it. And of course, the groups often will make kind of, you know, maybe a face group chat or a WhatsApp chat or Slack or something like that to keep in touch, and often end up kind of hanging out during their maternity leave or parental leave. So that was kind of pre-COVID. And because it's been such an important support system for a lot of people, we really felt strongly about continuing to offer that during COVID. So of course, it is now over Zoom. And you can still participate. We still do groups of 8 families per month. So everybody due in the same month. And we now have 1 hour. It's every 4 weeks. And then as you get a little bit closer, it's actually every 2 weeks where we all get together, and your facilitator, who's always the same person, it's either a midwife or a doctor, will have kind of an agenda of what they want to talk about, but also, you know, you're always willing to bring up any questions that the group has. And so we talk about labor and birth, and we have a pediatrician come, and we have a lactation consultant come, and even virtually, the groups have been, I think, a good source of community for each other, and are Some of them are doing some distance park meetups with their babies at this point. And so that's called centering pregnancy if you choose to do it. I know we have the groups through September due dates are full, and we're working on starting to open October. But we do a group every month.
And Kate, can you tell us, like, can someone do centering and see patients individually?
Yeah, so with Zoom, for traditional centering, we mostly just said that's your prenatal care. Although if some people needed to see, for instance, a high risk specialist outside of that, then that of course is fine. With it everything being on Zoom, you do still have individual prenatal visits, usually on the same day as your centering by the same person who's running your centering. But you still get those prenatal visits the same way that also an individual one. I think when COVID's over, we'll probably go back to the other model, but if COVID's over, whatever.
I know. Well, we'll get there when we get there, but it's very popular. We're very grateful to be able to offer centering to our patients at UCSF, as it's a model that's been, as Kate mentioned, like proven to improve people's satisfaction and overall feelings of support throughout the pregnancy. None of this was meant to be done in isolation. And so with centering, you kind of have this built-in support group that follows you through your journey. I wanted to now go to, now that we've kind of talked about your outpatient care or your clinic care, talk a little bit about delivery, because I saw some questions about that. So if you think you might need to deliver, you're having signs of early labor, or as I mentioned, if you are worried about something acute that should not be answered over MyChart or needs an immediate evaluation, you're going to go to the UCSF Birth Center, in which we have an obstetrics emergency housed. It is open 24/7. We always have staff that is going to be managing our birth center, and that is we're going to have a number of nurses. We also have at least 2 MDs, and ideally a nurse midwife there 24/7, as well as an MFM during the day. So we are well staffed, and our birth center is right next to the neonatal intensive care unit. So if we ever need assistance from our colleagues in neonatology or in pediatrics, they are readily available to come help us. So this UCSF Birth Center, it's located at 1855 4th Street. In one of the last pages of the guidebook that we give you, there's a map of the location and the number to call. I always tell people, print it out or take a photo of it or tear it out of your booklet and put it on your fridge. So you always have that. You always know where to call. The phone number to call is 415-353-1787. And you can call, and there will be different options available for you as to whether or not you speak to one of our advice nurses who's in an outpatient setting, or if you speak to someone on labor and delivery directly. We used to pre-pandemic have in-person tours where you could see our facilities, and unfortunately we are not able to accommodate those anymore. So you can get a virtual tour of the birth center through our Women's Health Resource Center website that Bertina will share with you. I have to admit it's a little outdated because everything is like, it was a nice video production that we did pre-pandemic. So hopefully in the next few months, we might have an updated video that just shows you what things look like. It's not so different, but with COVID precautions in place. Another thing to know is that you can go to the Women's Health Resource Center website under COVID, under the COVID navigation bar or under the birth center bar to get the latest on our visitor policy, as that is continuously being updated. We now we have for a while now been allowing for 2 individuals to come in with you, so a primary and a secondary support person. I would say for the most part, that secondary person has been a family friend, a family member, or a doula. And these individuals are allowed to switch out every so often, and that cadence can change. So I always refer patients to the birth center, the Women's Health Resource Center website, so that you can see the latest on our visitor policy. There's also a birth packet that Bertina is going to share with you, and I encourage you closer to delivery time to check out this packet. It has a list of suggested items to bring to the hospital. There's a sign you can print out to put on if you're going to drive to the hospital, that you can put if you need to park temporarily in the parking circle. And it just gives you general information about starting to prepare for delivery. Another point that I wanted to talk about is divert. So I don't know, let's use this function. Are we allowed to raise hands or not in this function? Maybe not. I just wanted to get a general sense of who has heard of divert, or if that's something that's come up in your conversations. But to be on divert, you might hear hospitals use this, is when you can not safely accept any more patients. So a hospital might be on divert because patients are using all of the rooms and it's not a safe place to bring in new patients, or if there's not enough staff to safely treat the patients. And this is an issue going on divert that actually all hospitals in San Francisco are facing at various times. And I mention it here not to cause anxiety, but actually to give you information about it, to know what happens in the case of divert. So we at UCSF have agreements with hospitals in the city in the event of divert status. And if you were to call to say, I think I'm in labor and it was not safe for us to accept any more patients, we will tell you where to go. And that might be Zuckerberg San Francisco General Hospital, CPMC Van Ness, or the Mission Bernal campus. And we'll give you the location and the phone numbers of these hospitals. And we will call those hospitals to let them know that we are sending you. The goal is for us to make sure you're getting the care that you need. So if you go to one of these hospitals and they evaluate you and you're safe to go home, then they'll send you home, and you can always call us back if you think you need to come back to the hospital. Very rarely, if you show up at these hospitals and you're in labor and it's you are on your way to delivery, then you will deliver at that hospital. If you are in one of those hospitals, the providers there taking care of you will have access to your medical records so that we can make sure that they have all the information they need about your health. And as I mentioned, this is not, or if I didn't mention this, it's not very common at all, but it's something that we want you to know about. I'm just going to check the chat again, make sure. Yes, there was a question about whether you can have a doula. Yes, we have allowed a doula now, or a second support person, for the past few months. And as I mentioned, the UCSF Women's Health Resource Center website is going to be the best to give you updates on our visitor policy. Kate, did you have something to add to that?
No, I've been trying to answer the questions in the chat as you go, so.
Yeah, no, thank you. So without further ado, why don't we have Kate, if you want to pick up and talk about who will be there when I deliver.
Yeah, sure, of course. This is one of the first questions I always get when I see someone in the office is, well, are you going to deliver my baby? And the question is always maybe. The answer, sorry, is maybe. Every provider has kind of a different profile in terms of who also delivers babies. For instance, the nurse practitioners, if you see a nurse practitioner in the office, they are not people that are going to be there to deliver your baby, but we work on shifts. And so those of us who do attend births, including Dr. Homaifar and myself, we may be there because we are scheduled to be there certain times during the week, but if we're not scheduled to be there, then we don't necessarily follow a certain person, but we follow our schedules, and that's true of all of us. When you do come to have your baby, the kind of default is that you will see a midwife. We really try to give everybody kind of the most appropriate provider for their situation. And for most people, the most appropriate person to attend your birth is a midwife, being kind of the experts in labor and birth. But for instance, we are not going to be the ones deciding which high blood pressure medication you need if you need high blood pressure medication. So we work really closely as a team. The way that our labor and delivery unit works is that there are at any given time several OBGYNs available. There's a high risk OBGYN available, and about 80% of the time there's also a midwife. So if there's a midwife there, we'll usually be the ones kind of caring for you while you're in labor, but also if there's, for instance, 2 babies being born at the same time, then you would have a midwife and a resident, and I'll get to residents in a minute, in one room, and maybe the OBGYN and residents in another room. So we all work for a team, and we do really try to come in when the teams change, because the teams change about every 12 hours. You'll get kind of new nursing staff, new midwife and physician staff. But we try to come and say hi so that you can see the possible faces that you will meet during the day. And I always say, just because you haven't seen the face of the attending OBGYN does not mean they don't know who you are, because we have multiple times through the day, we have conversations about kind of every individual person and what's going on for their labor and birth at that moment. And so we all work really closely as a team, and we all are kind of aware of who is there and what's going on. But it's not the kind of thing where you show up at the hospital and say, I would like to have a midwife, or I would like to have an OBGYN, because we all work as a team, basically. And it may be that, at one time you'll see the midwife, and a few hours later you'll see the OBGYN. Again, we're kind of working together, and it just depends on what those people are individually doing at that time. We did do a webinar, Meet the Midwives, because given what I've said, the most likely person that you'll see when you come is a midwife. So we did a webinar where all of the midwives introduced ourselves, and if you at least it makes it feel like there's a little bit of a familiar face, and if you're lucky, you'll have a familiar face of somebody that you've seen in the office. But because birth is so wonderfully unpredictable, it kind of just depends on when your baby comes, who you'll meet. When you do come to the hospital, some people that you will meet are our OBGYN residents, and if anyone is confused about what a resident is, like I once was, residents are people who have graduated from medical school, they're doctors, who then do a period of an OBGYN 4 years, where they work in a hospital and get the clinical experience that they need to be truly independent physicians. And we're super lucky that UCSF is, a kind of considered to be a good residency program. So we get to choose these amazing, amazing doctors who come and be our residents. And, they are involved in your care. This is a teaching hospital. And so it's not the kind of thing where you can opt out of that or opt into it. It's not really an optional thing. It's just kind of part and parcel of having your baby at UCSF. But the residents don't attend births on their own. They are always accompanied by either an attending midwife or an attending OBGYN, again, depending on the situation and what your needs are. And we don't kind of let them do anything until we've seen them do it well many, many times. And all the decisions are made as a group. So, the decisions that we make about recommendations, it's not going to be just, a resident decided that this was the recommendation. We've always talked about it as a group. Also, obviously, will be, decisions will be made with you as the main decider. So we work all together very closely, and your attending midwife or OB/GYN will be accompanying the residents. But we're really lucky to have them. They're amazing people, and they are involved in care. If you have a vaginal birth, kind of what does the birthday party look like? On our side, usually you'll see a midwife and a resident together receiving the baby, and then you'll have a nurse for you, and we call in a nurse for the baby at the last minute when the baby's about to come. So depending on the situation, we may or may not ask the pediatricians to come as well and sit in the corner. So usually they travel as a team. There's like maybe 2 or 3 of them. So it's that it's not going to be like 20 people staring at you having your birth, but probably these days one of the larger birthday parties, depending on the situation. And if you have a cesarean, it's a little bit of a different team. Usually it's one of the attending OB/GYNs together with 1 or 2 of the residents, and then of course a nurse for you, and then the pediatric team, and the anesthesia team. So I think those are the main things. Or is there anything else you would like to add about that?
I think you mentioned cesarean, and I'm sorry, I was answering the questions. I would say the other scenario where an attending physician might be in the delivery instead of a midwife is if we have to do an operative delivery. Did you talk about that, Kate?
I did not.
Oh, you didn't? Okay. So if you end up needing the assistance of what's called a vacuum or a forceps at the time of delivery, then that will be performed by an attending physician and resident. And I think there's not going to be too many of you, in which that would be the scenario. And that's always something you can talk to your prenatal healthcare provider about on your individual meetings to get a better understanding of it. Someone had a question about the nurse, like if the nurse will stay with you for the entirety of the shift. So it is most likely that every 12 hours you're going to meet a different team of people, and your assigned nurse is going to be the person that you probably see the most of during the day. But of course, that person might go on a break, and will be going on a break at some point. And so you might see another nurse briefly for that time. But in general, the entire team is usually turning over every 12 hours.
And in terms of like people coming in and out of the room, it's really just your main nurse for your shift, plus the nurse that gives them a break, and that's usually the same nurse, so one other nurse, and then your OB team, which is again usually either an OB/GYN and a resident, or a midwife and a resident. So that's your main team. It's not going to be like 10 different people. The one time when you have a little more people is when the baby's actually coming out. And so like if the pediatricians come, and they don't come to all births, they just come in if we think we have a chance of needing their help. They're just there for the birth. And if everything's great, a lot of times they just leave. They're only there for a few minutes, standing in the corner.
And in terms of the question about limiting staff members, which you touched upon, Pete, that we're not all trying to come in, and we do want to help foster a calm, respectful environment. So we really do try and limit the number of people to those who are essential. There are certain scenarios like delivery that we do need more people, and then in the event that we do need to have an operative delivery, or one that we would use forceps for a vacuum, there are going to be more people that come in the room, but we'll talk to you about it ahead.
And because we all work in a hospital, if anyone's thinking about it, pretty much all of us are vaccinated for COVID.
I saw the question about masking, and I thought we could also take the opportunity to talk about COVID precautions in the hospital. Again, these might change in the next few months as we see an increase in the number of individuals who are vaccinated. As of now, we're asking that everyone, even the healthcare workers who are vaccinated, continue to wear masks and in the hospital setting. We are going to, we have a nurse who is dedicated to everything COVID. Her name is Deirdre Coble, and she will get in touch with you ahead of your plan, if you have a planned induction or a planned procedure, to let you know about outpatient COVID testing. We are also testing all of our patients once they come into the hospital. And for updates in this testing policy, you can always check our Women's Health Resource Center website. Even though we are getting a majority of COVID negative results, we are still asking people to try and maintain masking when other providers are in the room. During active labor, or sorry, during the second stage where people are pushing, I will say we recommend or suggest that people leave on their masks, but many people, especially if you're COVID negative, are taking it off. So I think the general stance is we would like you to try and mask when someone comes in the room to talk to you, and especially your support people need to mask. But we understand that during pushing, that's most likely not going to happen. We'll talk about we will provide surgical masks for you when you come into the hospital. So part of your check-in process to the hospital, or anytime you come to our obstetric emergency room, to go through a health screen at the front of the hospital. And this also happens in the outpatient clinic setting too. When you answer a set of questions, and you will be given a mask and hand sanitizer and a sticker to indicate that you've gone through the screening process. All visitors that come to the hospital also have to go through that screening process. Okay. I think, and as I mentioned, the answers are, based on currently what we're doing. If in 2 weeks we get updates from the medical center, because we are at an all-time low for our COVID rate, we currently only have 10 COVID positive patients in our health system, which is remarkable. Then our policies might change, and we'll keep you updated on our website. I think that's a great segue into how people can get more information and resources and support. Kate, why don't you tell us on how people can access support for questions, and then I'll end with the WHRC.
Sounds great. I think there are several layers of kind of how you can ask us questions, basically, and which one you use really depends on how urgent the matter is. So I hope everybody already has a MyChart account, and if you don't, that's a really important thing to have, because that is your kind of online portal to UCSF, so you can see your test results. I'll give a brief warning. Some of the normal ranges that they use for those test results are for non-pregnant men, so it doesn't automatically mean there's something terrible if it's outside of the normal range, but we'll always get in touch with you if there's something that we're concerned about with your test results. And the way that we often will do that is through MyChart. So if you're MyChart, you can send a message to any provider you've seen. We can send messages back to you. The way that MyChart messages work in our department for most of us is that if you send, for instance, you've seen me and then you have a question, we ask that the MyChart messages be things that you want to know, but it's not urgent. So you can get an answer back within a few days. So if you send a MyChart message, it actually gets looked at first by the nurses. We have an amazing group of nurses that work with us. And if there's something that they can answer for you, they will just get straight back to you. They'll identify themselves as one of our nurses and give you the answer to your question. If it's something that they think, or you think that one of us, or specifically the person you've sent it to, needs to see, then they will forward it on to us, and then we can message you back. So do look at your MyChart messages, because sometimes we are sending you some important information through those messages. If you have something that's a little bit more urgent, bleeding, baby not moving, something like that, you should definitely call us. There's a couple of different ways to get in touch with us by phone. We gave out earlier the number to the obstetric emergency room. You can also use the regular phone number that you would use to make an appointment. During the day, between 8 o'clock and about 4:30, there are nurses that are available to answer any questions on the phone. So during daytime hours, that's a great way of getting to us. And it's just the regular number that you would call to make an appointment. And ask them to speak to a nurse. If it's not daytime hours, Monday to Friday, and you call that number, what you'll get is the answering service. And so somebody will answer, they'll take down your phone number and your name and your date of birth and kind of a brief, what's your question? And then they'll give us a call. And as we mentioned before, there are midwives and doctors who 24/7, 365 days a year are available because we're attending births. So that call would then go into the person who is awake and attending births, and we can call you back. We would call you back. There may be a short lag time because if, for instance, I am in the middle of catching a baby, I may not be able to call you back for, an hour or something like that. But that is another resource that you can use. We do ask that if you call us in the middle of the night, it be something that is somewhat of an emergency. Just again, because we're kind of doing other things. But if you have that situation, we definitely want you to feel like you can get in touch with us. And that is true on the weekends. It's true on Thanksgiving and Christmas. Like there is always a way to get in touch with someone if you truly need to do that. So those are the best ways to reach us. And again, it just kind of depends on how urgent your question is, what method of reaching someone that you use.
Great. And now I want to briefly take you all. I know we've been sending you lots of links in the chat, but I'm going to share my screen and take you through our Women's Health Resource Center website so you can get a better sense of hopefully this resource that we have that we hope is going to be very useful for you. So let me just share my screen. Okay. So this is our Women's Health Resource Center website. And on it, you'll find that we've divided, it's not just for prenatal patients, although the majority of the information on it is kind of geared towards them. I'm going to mute you for a second, if that's okay. Thank you. In terms of the navigation bar, you'll find here that we have information on prenatal care at UCSF, our COVID-19 updates, classes and webinars, breastfeeding, information on the birth center, and resources. So I invite you to pull up this page for yourself and at some point go through it and bookmark it and share it with your partner or support people as well. So under UCSF prenatal care, you'll see our general approach, the different locations and numbers. There's information on centering there. COVID-19 updates was meant to have everything COVID related. So we talked about the outline of prenatal care. You can find that outline here. Several of you have questions about the visitor policy and the testing policy. So all of this, as well as the date of that reflects when the updates were made, will be here. And then in other general questions that we get, there were some questions about masking, and also no one has asked this yet, but there's always a question about like food. Classes and webinars, this is meant to just give you a sense of everything that is offered at our UCSF department. So we have fee-based courses. Those are the Great Expectations or the new NEST courses that you'll probably want to take in the 3rd trimester. And you can find a description of those courses here. That's more formalized, longer courses that really hone in on certain topics, as well as the webinars that we discussed. We also have several support groups that you can read about. In terms of birth center, as I mentioned, this is where you can go watch the virtual tour and see how to reach UCSF. The tour packet that we discussed as being helpful closer to your delivery date is going to be located here. And then resources, this is a kind of a mishmash, but here's where you'll find the different webinars, the non-fee-based webinars that we've done. So Zooming through pregnancy to parenthood, we've organized it by trimester. So you and again, your support people can have a sense of how to stay up to date on very common topics that people want to talk about or learn more about in pregnancy. So many of these have been recorded previously and the recording is linked here. You're welcome to share with friends outside of and family outside of the UCSF system as well. I always like to refer people back to this, especially in the third trimester, as we start thinking a little bit more about preparing for delivery. And then if you want to register for any courses or webinars, you can find them here. So please, if there's any, hopefully there's a lot of takeaways from today, but specifically, like, I think a lot of oftentimes many of the questions people have can be answered in one of these resources that we have available to you. I want to talk briefly about the COVID vaccine. I know it's 12:59 and people probably have questions. All vaccine distribution is being handled at a medical center-wide at the level of the medical center. So I know patients were receiving messaging in the past week or so that vaccines were going to be made available. We are not administering the vaccine in the outpatient setting or at our birth center. If you do choose to get vaccinated, you have to go through the MyChart portal and sign up for an appointment time. We're going to update our tab on the Women's Health Resource Center, hopefully in the next few days, to give you more information about the COVID vaccine. We did have a webinar back in January 11th about the safety of the vaccine and whether it's right for you. So I encourage for those of you who have specific questions who haven't watched the webinar, I know it was almost 3 months ago, but the information is pretty much still the same, even with the introduction of the Johnson & Johnson vaccine. The gist of it, because this could be a whole other hour discussion, is that we understand that these vaccines have not been studied specifically in pregnant patients or those who are breastfeeding, but there's fundamentally nothing about the vaccine and its structure that we believe poses a risk to the birthing parent or the fetus or the baby. So, and we do know that there are risks, that the risk of COVID to the pregnant person are higher when they're pregnant. They're more immunocompromised compared to when they are not pregnant. So while I cannot come out and say, well, let me step back. All professional organizations in the United States, the American College of Obstetrics and Gynecology, the American Society for Reproductive Medicine, the Society for Maternal Fetal Medicine, the CDC, all of them have come out to say that we should be offering the vaccine to our pregnant patients and discussing it with them. But because we don't have official studies, we can't come out and say we officially recommend it. And Kate, I apologize. I'm sure the CNM world has, I imagine there's a statement that's been put out as well. But there's fundamentally, we think, we have no reason to believe that there are long-term effects. Well, we have no reason to believe that the vaccine is unsafe in pregnancy or while breastfeeding. And as one of the physicians I was talking earlier today mentioned, is that we don't really know what the long-term effects of COVID are going to be on a potential, on the person and potentially the fetus as well. So our pregnant patients have been prioritized currently, and then those who have medical conditions that make them more at risk of having a COVID infection are going to be probably prioritized more. I have no insight into that process except what I'm sharing with you. But we have several sources that we can provide you about how to think through the vaccine, and if it's something that is something that you want to pursue. I apologize, that was really wordy, but I'm including some information in the chat, some decision aids that were made, and some information that I think is really useful for people to have about the vaccine. Okay, it's 1:03. I just want to see if, Kate, if there are any other questions that you think we need to answer, and if anyone else has any questions. Let's see.
There's a question about whether or not people will get a My Chart message when there's vaccines available.
My understanding is that they will, and this is where I defer to Deirdre, who is our official COVID nurse coordinator. So we will be updating our Women's Health Resource Center website in the next few days with information on the vaccine. But yes, my understanding is that you will get a notice in My Chart that the vaccine might be made available to you. And then there's like a link that you would go to if you're interested in finding it. It does not, in general, it does not matter which trimester we get the vaccine. And that is a question that we actually answered in the webinar we did. If you look under the Women's Health webinar series, you'll find that we answered that question if you'd like more information on it.
The other thing is that a lot of people are getting their vaccines at other places, at the Moscone Center, at Safeway or Walgreens. So you don't need, UCSF will not have a different vaccine than the one that's at these other places. So if you're feeling like you want to get one sooner and UCSF doesn't have availability of vaccines yet, there are definitely people who are going to those other places to get their vaccine.
Absolutely. And the phonecast.org link that I just said is has a fabulous decision aid made by a group of doctors and specialists at State Health, and it's available in different languages. And it specifically talks about the Johnson & Johnson, Moderna, Pfizer vaccine for pregnant and breastfeeding patients and how to think through if it's right for you. So I encourage you to use that resource and send it to family and friends if you find it. Okay. Wow. Thank you all for joining us today. We hope that this was helpful, and we will certainly learn from this experience and hopefully improve our orientation going forward. I'd like to thank Tina Lee and Bernstein Scargarelli of the Women's Health Research Center for helping us put this together. We'd love to get your feedback on how we did and how we can improve our webinars in the future by having you fill out the evaluation we'll send out shortly. Thank you, everyone.
Thank you, everybody.
Have a great day.
See you soon.